Hello, this is Betsy Bogard. That's my picture down in the right corner. I am very glad to be speaking with all of you. I wish that I could be in Sweden in person to wish you all a wonderful FOP Awareness Day. Marie invited me to speak about the FOP Registry that we will soon launch. Thank you, Marie, for that wonderful invitation. It is a privilege. For those of you who don't know me, I have a brother, Judd, who lives with FOP in Southern California. I currently work at the International FOP Association on our engagement with FOP research and drug development efforts worldwide. Before that, I spent 10 years at Genzyme, a biotechnology company in Boston, working first in registries and then in rare disease drug development. Creating a registry is one of the most valuable actions any rare disease community can take to help get a treatment. I think IFOPA's registry project is one of the most important projects we are working on. I want to share this quote from Eurydice as a reason why it's important we are talking about a registry. In Eurydice's words, where well-implemented registries and active patient organizations exist, the likelihood for developing a treatment for the disease in question is increased. Registries play a critical role in rare disease drug development. They can help demonstrate that a community is present and active, which is especially important for a disease as rare as FOP. They can help show trends in disease progression and in quality of life, trends that can be hard to detect for a rare disease without the large number of participants made possible by a registry. They can help a pharmaceutical company determine trial eligibility criteria. They can help patients learn from each other through survey results. They help provide a real-world picture of a disease. Those are some of the uses of a registry, but there can be many more. You can see even from those few uses why we need a registry for FOP. It is essential for our search for a treatment. Our intention is to have one global registry for FOP, not multiple FOP registries. Dr. Kaplan has been a strong proponent of this. It can be easy to have multiple registries for the same rare disease. There are many examples of this, and it can be problematic. Having multiple registries can weaken the data in any one of them, or create more work for doctors and patients. For FOP, we want just one registry. In order to avoid having multiple registries, we must meet the needs of all stakeholders: patients, researchers, physicians, and pharmaceutical companies. We are designing our registry to do this, and we have defined 4 goals for the registry. 1, to help organize the community for clinical studies. 2, to help empower patients and the community by allowing them to see data about themselves. 3, to improve the collective understanding of FOP. And 4, to advance the understanding of treatments once they are available. This is the homepage of the registry. We are still finishing development, so you can't yet see it online, but it will be there soon. The registry will at first be accessible to FOP patients, and later we plan to build components of it for doctors. The registry provides the opportunity for patients to enter information about various aspects of their disease, including the experience of getting diagnosed, flare-ups and progressing heterotopic ossification, the impact of FOP on other body systems, such as gastrointestinal symptoms or hearing loss, quality of life, and use of healthcare services, including participation in clinical trials. We have given a lot of thought to the frequency of data collection in the registry. We had the choice of allowing patients to enter data anytime they want, every day, every month, once a year, or at set intervals. We are going to start with set intervals, every 6 months, and see how well that works. When you participate in the registry, there are 3 parts to what you will do and how you can get involved. The first is to register. Registering lets the system know you are here, that you exist. No one except for the few people at IFOPA who manage the system will see you by name, but you will then be in the system. It will ask you to confirm that either you are a member of an FOP patient organization, such as FOP Sweden, or to upload a report confirming you have an FOP diagnosis. The second step, after your registration is confirmed, is to enter information about your experience with FOP up until now. This is called the enrollment survey, and it will ask about your experience with FOP dating back to your diagnosis. You will complete this survey only one time. The third part is to enter current information about your experience with FOP every 6 months. This is the long-term part, the part that's really, really important to keep doing, and the part that's hardest for a community to do. As patients begin putting data in, we will start to learn things about FOP, and we will share these summary learnings back with you so you know that your participation is making a difference. As we build the medical portal, where doctors will enter data, they too can start to add to the understanding of FOP in the registry. You and your doctor will be able to see your own data and de-identified or anonymous data for other patients. IFOPA will share summary learnings with the FOP patient and research community, and with your permission, share de-identified data with other global databases. We are finishing construction of the registry, which has been difficult and has had some setbacks, but we are getting there. The registry will be available first in English so that we can check for any problems in just one language. We would like for 30 to 50 patients to be the first to try the registry using computers and tablets. IFOPA will then work with all the national FOP groups, like FOP Sweden, to develop plans to translate the registry into other languages. We have identified 16 potential languages into which we could translate the registry, and we'll need to have a schedule and a plan for how and when we will do those translations. IFOPA will also work to develop the smartphone version of the registry so that you can use it easily on your iPhone or other small devices. And later, as I mentioned, we will work to build a medical portal so that doctors can participate in the registry too. We are developing an advisory board and governance structure to guide and oversee the registry. We held a first meeting of medical advisors in November in conjunction with a larger FOP drug development forum we hosted in Boston. The meeting included 13 physicians from 11 different countries, representatives of 3 pharmaceutical companies, representatives of our technology partner, Digital Infusion, and a few IFOPA representatives. We also want to create a patient advisory board and will propose a composition that includes a mix of international and U.S. representation, parents and patients, and both International President's Council and IFOPA representation. I want to mention how the registry is related to some other projects in the community. It will help support clinical trial planning. It could potentially be connected to a biobank. It is connected to the FOP in Numbers project that Marie is working on for the International President's Council. And it is connected to the Clementia Natural History Study. We are thrilled to be developing a data sharing agreement with Clementia so that the registry will be able to include data from the natural history study for the whole community to learn from. We thank Clementia for their vision in engaging in this agreement with us. I want to close by saying, in all that we do, and in all the ways we are connected, we are stronger. One of my favorite ways to sum up the value of the registry, and the value of working together, and of everyone being involved and coordinated comes from NORD, the U.S. Rare Disease Organization, whose motto is, "Alone we are rare, together we are strong." That is, for me, the essence of a registry. We at IFOPA will keep you posted on the progress of the registry and very much look forward to the day that the FOP community in Sweden participates in the registry to share your experience of living with FOP and help all of us get to a treatment and a cure. Thank you.